Hi, it's Nick here, MedTech World 2025, Day 2. Delighted to have Sabrina Hellstern here with me from Hellstern Medical. Good to have you. I've just watched the most amazing promo video. I've watched how your technology, how your offer, how NOAC, this robot, how it changes the game, turning what could be days on the operating table into hours, minutes. And for the first time, whilst there have been robotic, obviously, involved in surgery for more 20 years, now we've got 95% of procedures covered. It's amazing, Sabrina.
Yes, thank you for the invite to talk here. Yes, the surgeons came to me personally with their huge problem. So I founded a company to solve this problem. My name is Sabrina Hellstern. I'm the founder and managing director of Hellstern Medical. And it's important to know the surgeons are the reputation and revenue driver of the hospital. And they have to stand hours and hours in pain next to the operating table. 75% get work-related musculoskeletal disorders. 40% take painkillers regularly to give their performance to the patients. And the next huge problem is the demographic change. So on one hand, we have more patients, they need more surgery. So the numbers of surgeries increase every year to up to 3% per year. On the other hand, we have a lack of skilled surgeons. So 2030, every fourth position is vacant. And when we have a look in the US, every hospital lose 3 million revenue when they have an open position and a vacant position. So what we developed is a very intelligent robot. It's a robotic surgeon assist. And so we support the body of the surgeons, and we feel the movement of the surgeon. The device follows him. So with our device, we can offer the same benefits like the traditional surgical robots, yes, but after 20 years they are on the market and they can cover only in Europe 5%, in the US 10%, and we offer the same benefits like the huge traditional OR robots, but for 95% of the procedures for at a tenth of the costs.
I know the two sectors are disparate,
Yeah.
but I spend a lot of time on like the top movie sets in the world, very small part of, and there's a man on set. He's like the most skilled, talented man, but he's like a merger between him and technology. It's the motion camera person. As they move, the technology flows, almost robotic. But this is, in your sector, I see the same thing with the assist. I see the man and machine coming together in a way that
Yes.
just improves, so that creates time, prevents the strain on the surgeon's body in real time. And this is just from a promo video that they've got to see to believe what this does.
Oh, thank you so much. Yes. Yes, you call it in the right way. It's a human machine interface. We bring, with our robot, we bring the body of the surgeon to the same level with industrial robots and cobots and so on. So with our device, it's proven by studies that we reduce the muscle fatigue of the surgeons, and there is a direct correlation between the muscle fatigue and the surgical precision. And it's also proven by studies when the surgeon use our device, we can reduce the medical errors up to 67%. So we have three arguments to use our robot. On one hand, that we reduce the pain, the fatigue of the surgeons, we strengthen their career, yes, they doesn't have to retire earlier anymore based on musculoskeletal disorders, and we need them on the
See, we need them.
table.
They have all of the knowledge, the experience in their
Yes,
hands with the
of
procedures.
course. Yes,
See,
when you need a complex surgery, you want the best and the surgeon with the most experience, and they are not 20 anymore.
it may have taken years, and it may have taken a lot of money and development and mind work and the best minds and
Yes.
engineers. But those surgeons that came to you with a problem, you've come back to them with a solution. NOAC, it's incredible. Thank you, Sabrina, for being with us. Nicholas signing off from MedTech World.